If someone in their old age suddenly loses weight, it can be really concerning for that person and their family members. While it's true that people tend to gain weight as they get older, there are still certain situations where elderly individuals can experience weight loss. So what causes sudden weight loss in old age, and how can we prevent it or treat it if it happens? This can be because of a decrease in appetite, or it can be because the person is unable to eat as much as they used to because of dental problems or swallowing problems. In elderly patients, decreased food intake is often due to depression, which is more common in old age than people realize. An example of this would be hyperthyroidism, where the thyroid gland is working too fast and causing the metabolism to speed up. But there are other conditions that can do this as well. One of the most common causes of increased metabolism in elderly patients is chronic obstructive pulmonary disease, or COPD. This is a group of lung diseases characterized by inflammation and constriction of the airways, which makes breathing difficult. Loneliness can take a toll on a person's mental and physical health, leading to depression, anxiety, cognitive decline, high blood pressure, and other health problems. As we age, our muscles can become weaker, and our nerves can become less responsive, which can make it difficult to swallow food. As people age, their nutritional needs change, and it can be difficult to get all the nutrients you need from food alone. But as we age, our stomachs and intestines become more vulnerable to ulcers and other types of bleeding. As we age, our immune systems become weaker, which makes us more susceptible to infections. This makes breathing difficult and can cause symptoms like shortness of breath, wheezing, and coughing. COPD is most commonly caused by smoking cigarettes, but it can also be caused by exposure to secondhand smoke or other lung irritants. Please let me know in the comments below if you have any questions about weight loss in the elderly, or if you want me to cover any specific topics in more detail in future videos. Thank you so much for watching, and stay healthy, my friends. COPD can cause weight loss in two main ways. First, it makes it more difficult to breathe, which means that the body has to work harder to get oxygen. This extra effort can burn calories and lead to weight loss. Second, COPD can make it more difficult to eat and absorb nutrients, which can also contribute to weight loss. Infections can cause a number of symptoms, including fever, chills, sweats, weakness, and weight loss. It's important to pay attention to any changes in your health or your loved one's health, and to see a doctor if you're concerned. With early diagnosis and treatment, many of these conditions can be managed effectively. This can help improve quality of life for the elderly and allow them to enjoy their golden years. Some common infections that cause weight loss in the elderly include pneumonia, urinary tract infections, skin infections, and blood poisoning. If you think you or a loved one may have an infection, it's important to see a doctor right away. Prompt treatment of infections can help prevent them from becoming more serious. This can lead to anemia, which causes weakness and fatigue, and can make it difficult to eat and keep weight on. GI bleeding can also lead to other problems like blood in the stool or a drop in blood pressure. If you notice any of these symptoms in yourself or a loved one, it's important to see a doctor right away. Early diagnosis and treatment of GI bleeding can prevent serious complications. This is especially true if you have a chronic illness or are taking multiple medications. Malnutrition can lead to a number of health problems, including weight loss, muscle loss, weakened bones, and a weakened immune system. To prevent malnutrition, the elderly should eat a balanced diet that includes plenty of protein, fruits, vegetables, and whole grains. If you're concerned about your nutrition, talk to your doctor or a registered dietitian. It can help you create a meal plan that meets your individual needs. This can lead to food getting stuck in the throat or even backing up into the lungs, which can cause choking or pneumonia. People with swallowing problems often end up eating less because it becomes too difficult or too uncomfortable to do. Conditions like stroke, Parkinson's disease, Alzheimer's disease, and head or neck cancers can all cause swallowing problems. If you notice that your elderly loved one is having trouble swallowing or is losing weight without changing their diet, it's important to see a doctor. So it's important for the elderly to stay connected with friends and family, either in person or virtually. There are also many community programs that offer social activities and support groups for the elderly. So don't hesitate to reach out and connect with others in your area. COPD is most commonly caused by smoking cigarettes, but it can also be caused by exposure to secondhand smoke or other lung irritants. It can also be due to loneliness or a lack of social support. This can happen because of changes in the digestive system that happen as a person ages. The first one we're going to talk about is cancer. Depression is a common mental health condition that can affect people of all ages, but it's especially common in the elderly. Symptoms of depression can include a depressed mood, loss of interest in activities, feelings of hopelessness, difficulty concentrating, memory problems, and changes in sleep and appetite. If left untreated, depression can lead to other physical health problems like heart disease, diabetes, and even cancer. So it's important to seek professional help if you or your loved one is experiencing symptoms of depression. Cancer is one of the leading causes of weight loss in elderly patients. And it's important to get checked out if you or your loved one experiences sudden weight loss without changing anything in their diet. The most common cancers that cause weight loss are lung cancer, pancreatic cancer, stomach cancer, and colorectal cancer. If you notice any other concerning symptoms along with the weight loss, like a change in bowel habits, difficulty swallowing, or pain when swallowing, coarseness, cough, or shortness of breath, then please talk to your doctor. These could be signs of a potentially serious problem like lung cancer. Also, inflammatory bowel diseases like Crohn's disease or ulcerative colitis can make it harder to absorb nutrients from food. 8. Certain medications like diuretics or PPS can also cause weight loss in elderly patients. And these are all worth discussing with your doctor or pharmacist. Also, changes in taste or smell can make eating less enjoyable and can lead to decreased food intake. And as people get older, they may become more forgetful and may forget to eat, or may not remember that they've already eaten. That's what we're going to talk about in this video. This could be because of increased activity, but in elderly patients, it's most often caused by some sort of underlying medical condition that's making them use up more energy than usual. Some examples of this would be hyperthyroidism, or an overactive thyroid, where the thyroid gland is working too fast and using up more energy than usual. Another example is being treated for a slow thyroid condition called hypothyroidism, with too much thyroid hormone replacement. Also, some cancers can cause weight loss. So it's important to get checked out if you or your loved one experiences sudden weight loss without changing anything in their diet. Hi, I'm the host. I'm an internal medicine doctor who treats a variety of conditions, including many elderly patients. Let's get started with understanding what causes sudden weight loss in old age. Generally speaking, there are 4 main categories of causes for sudden weight loss in anyone. The first is decreased food intake. The second category of causes is increased energy expenditure. The third category of causes is increased metabolism. The fourth category is decreased absorption of nutrients from food. Now that we've gone over the main categories of causes of weight loss, let's go through some specific causes of weight loss in elderly patients. Another condition that can cause weight loss in the elderly is depression. Another thing to consider is loneliness. This can be a big problem for the elderly, especially if they live alone or have recently lost a spouse or close friend. Swallowing problems, also known as dysphagia, are another potential cause of sudden weight loss in the elderly. Malnutrition is another potential cause of weight loss in the elderly. Gastrointestinal or GI bleeding is another potential cause of weight loss in the elderly. Infections are another possible cause of weight loss in the elderly. Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases characterized by inflammation and constriction of the airways. As you can see, there are many different things that can cause weight loss in the elderly. I hope this was helpful. Thanks for watching. Hope you liked it. As well as, please let us know, where are you watching from before leaving? Please hit the subscribe button, comment your thought, and share with your nearest and dearest one. See you in the next one. Till to the next one, stay happy. Goodbye.